Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Living bacteria with their ability to reproduce to fantastic numbers and the resultant pollution of their environment by their metabolic and waste products are the major cause of dental disease, both dental caries or decay and periodontal or gum disease. Through the use of the microscopic projection of living bacteria on the television screen, an attempt is made to educate and motivate the patient to the involvement of bacteria in their dental health. Removing a small amount of plaque from a patient's tooth, preferably adjacent to an inflamed area of gingiva, increases the likelihood of significant numbers of motile organisms. The student then prepares a slide with a drop of water and a cover slip and proceeds to the microscope. The use of balsam oil and an oil immersion lens on a phase contrast microscope allows greater magnification than is possible without oil due to the refraction of light. Focusing the microscope also focuses the television camera, and the bacteria become visible to the patient on the TV monitor, where the living bacteria can be observed and discussed while both the patient and the student are viewing the picture. The use of a 100-power oil immersion lens times a 10-power ocular lens give 1,000-power magnification. This is further enlarged approximately 5 times by the TV system, resulting in a 5,000-power relative magnification. This is somewhat different than a true 5,000-power magnification that would be possible with electron microscopy. However, it does give the effect of a 6-foot-tall man becoming 30,000 feet tall, or nearly 6 miles tall. A patient with normal healthy gingiva and a minor amount of plaque will microscopically generally exhibit masses of primarily streptococci, which when free of the mass will exhibit Brownian movement or vibration rather than true mobility. Squamous epithelial cells may also be present. As gingival inflammation becomes evident with redness, swelling, and bleeding tendencies, the plaque removed will be older and more mature. The more mature plaque will be of a mixed composition of cocci, rods, spirochetes, and red and white blood cells. The known 7-micron size of a red blood cell allows calculation of the total screen area to be approximately 100 microns, or a very small grain of pepper. It also shows a streptococcus to be about 1/2 micron in size. If a Streptococcus mutans of 1/2 micron is compared to a man of 2 meters, with 1 meter being 10 to the 6th or 1 million microns, a ratio of 1 to 4 million is established between the size of a Streptococcus and a man. This would be the same as a grain of sand to the Empire State Building. Or a Streptococcus could hide in a man the same as an ant could hide in all of Washtenaw County. A lemon floating in Lake Michigan has the same 1 to 4 million size ratio. Or you are to the state of Michigan as a Streptococcus is to you. As inflammation occurs in the gingiva, live white blood cells with their ability for amoeba-type movement will also be found. The calcification of plaque from deposition of minerals will form calculus on the tooth surface. Here is a very small nodule of calculus that has started calcifying in rings around a nidus of some component of plaque. The layering effect of calcification is still evident even as the deposit of calculus becomes greater. As the plaque becomes more mature, the number of rod-type organisms increase, with various types of fusiform and long filiform varieties present. There are still numerous cocci present, with some in the form of chains, besides the appearance of more motile organisms. Considering a square millimeter of tooth surface as having 1,000 organisms present when it appears clinically clean, and a relatively low reproduction rate for bacteria of 12 hours, the number of organisms will quadruple each day if not removed. Starting on day 1, the population on 1 square millimeter will go to 2,000 and 4,000, and so on each day until by the 4th day it has exceeded the seating capacity of Michigan Stadium, and continuing to more than the population of New York City by the end of the week. When the inflammation of the gingiva becomes severe, as in this case, the number of spirochetes increases and the size of the motile organisms becomes greater. The length of these specimens is greater than the size of a red blood cell at 7 microns. There are still large numbers of other bacteria. This amount of plaque removed from the surface of a tooth with a dental explorer will easily contain several million bacteria, representing the population of Detroit. A square millimeter of tooth surface that becomes coated with plaque can have a population of 100 million living organisms, and by multiplying that with the total surface area of a 1 centimeter square molar, or 100 square millimeters, the 10 billion organisms that could be inhabiting that molar has exceeded the population of the world. Obviously, there is a problem of controlling the potential growth of the bacteria on the teeth, and this is presently done by good oral hygiene measures of brushing, flossing, and a proper diet. For without constant daily control, the population expansion and its accompanying metabolic products will soon cause dental disease, just as uncontrolled overpopulation has caused pollution problems in the world.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.